Hi, I'm Holly Milkowski, a doula, childbirth educator, placenta specialist, and birthing rights advocate. In this video, I'm going to share a few tips for choosing a care provider for birth. As you may already know, your options include an obstetrician, also known as an OB or an OB-GYN, various types of midwives, which include a certified nurse midwife or CNM, direct entry midwife, such as a certified midwife or CM, or a certified professional midwife who is a CPM, or a traditional midwife who may refer to herself as an independent or lay midwife. Some pregnant people choose to be responsible for their own prenatal care and birth without a care provider. But since you've clicked this video, I'll just assume you've already decided to hire a care provider. Let's quickly compare these provider types. The vast majority of women in the US choose to birth with an OB at a hospital. OBs are trained surgeons who specialize in things that can go wrong and follow the medical or scientific model of birth, which has an emphasis on routine testing encouraged for all women despite risk factors, a view of birth as pathological, and that technological birth is most scientifically sound. This model focuses heavily on certain aspects of the process, like cervical dilation, and certain parts of the body, and labor is measured in very mechanical ways. Other aspects of pregnancy and birth, specifically those of the emotional and hormonal realm, are largely unacknowledged, and the woman is referred to as a patient here, even if healthy and not sick. The holistic model or midwifery model is different in that there's a belief in birth as a natural and physiological process. Birth is not inherently an emergency or medical event. Preventative care is emphasized, so women stay low risk, and the whole woman in different aspects of her life are believed to influence her birth experience. It's important to note that not all midwives practice this model. In fact, many follow an approach that more closely resembles the medical model, with drug prescription and out-of-hospital interventions and what have you. Basically, licensing of care providers, whether an OB or midwife, creates a fear of litigation, and keeping the license means following whatever protocols are put in place by the state or the organization, even if it's not in the best interest of the birth giver. And while they're following those rules, by working with them, you're essentially agreeing to follow the routines as well. Are these protocols and routines in line with what you want? Something to definitely research and think about. So essentially, a home birth with a midwife won't necessarily be holistic. Sometimes nurses attend home births as assistants, and a lot of unnecessary clinical care happens. Or someone hires a midwife thinking they will be very hands-off, but find the opposite is true. A hospital birth may not be necessarily full of invasive routine interventions and high technology either. Certified nurse midwives work mostly in hospitals, actually, and I am sure that it's possible to find a more holistic-minded provider should you need or want to birth in the hospital. Difficult to be real with you, but possible, sure. So I learned about another model of care from Indie Birth. It's called the Wise Woman Tradition, and it was put forth by Susan Weed in Healing Wise. To paraphrase Susan's words, this is woman-centered, heart-centered. It has no rules, no texts, no rights. It is constantly changing, constantly being reinvented, open to the ever-changing perfection of the eternal moment. The focus is on the person, not the problem, nourishing, not curing, self-healing, not healing another. So whatever model of care sounds best to you in regard to your birth, I think the first step really is to spend time thinking about where you want to have your baby. Hospital, birth center, home. I can't get into the pros and cons of all of those in this video, so definitely look into your options there if you haven't already, and sit with your feelings on it for a while. Hopefully you'll come up with something that feels really good to you. So the next step is thinking about what you want from your provider. What kind of support and information do you want during pregnancy? What are your expectations in regard to personal connection, bedside manner, experience with certain things? Make a list that matters to you, and then make a list of what matters to you, then circle what's most important and start there in your research. Choosing your best provider is so much more than just are they available on my due date, and do they take my insurance, and did my neighbor's sister's best friend have a fine experience with them, and so I guess it'll go okay for me too. So let's talk about other considerations that can really matter. If you're here, you probably already know how significantly your choice in provider can influence your birth experience, for better or worse. I won't get into all the whys and hows of that right now, but I will give you some ideas of questions to ask and red flags to look out for. Before you start interviewing, do your research. So this is your responsibility. Find out the provider's track record. What are their stats for episiotomy, cesarean, induction, VBAC? How about the track record of the place where they work? Can you reach out to other local mothers and doulas, other birth workers, and gauge what their experiences have been like with this person? So if you do like what you've seen and heard thus far, next step is to set up an interview. At the interview, don't just ask yes or no questions. For example, let's say you want an unmedicated birth with an OB. Don't just ask, do you support medicated birth? Maybe they say yes, and they probably will. But then 20 weeks later, you find out only 10% of their clients birth without an epidural. Why is that? Maybe the question could have been phrased differently from the beginning. For example, how often do your clients birth without an epidural? They might say, not many. That's when you need to dig for elaboration. How do you feel about that? Or why do you think that is? You may find out they require all mothers to stay on the hospital bed throughout labor, or they routinely give Pitocin upon admission, both of which often lead to epidural, as you might already know. So in this case, maybe it seems their idea of supporting unmedicated birth means they're fine with it happening, but they're not in the business of actually catering to that sort of thing. Even as pregnancy progresses, you should still be asking hard questions to a provider you've already hired, ones that illuminate opinions, feelings, what plans they have, what alternatives they can offer, why they can't or won't offer other options. Let's say you're working with a midwife at a birth center and you're low risk and healthy. You discover your baby is breech, and midwife says, oh, there's plenty of time for baby to turn. And that sounds great, right? But weeks go by, and now you're 41 weeks with a still breech baby, and she tells you she needs you to transfer for cesarean because she can't deliver a breech baby at the center. So maybe earlier, when hearing your baby was breech weeks ago, if you didn't feel satisfied by the information given to you, maybe you could have investigated further, asking, how do you feel about that? How do you feel about my baby being breech? Is that an issue for you? What are my options with you if my baby remains breech? Obviously, it sucks that women aren't always getting straight or full answers to their questions, but you need to be your own and your baby's own best advocate. So wherever and however you choose to give birth, your provider should definitely believe in you 150%, support your birth wishes and not just tolerate them, have experience with the kind of birth that you want. A lot of people are really surprised to learn that there are a lot of OBs out there who have never seen a fully unmedicated birth. And if that's something that you want, that it might be a red flag. This person should also be someone you look forward to seeing. So I have a lot of students and clients who are always talking about how they dread going to their prenatal appointments, and they dread talking to their care provider, and they push off asking their care provider any questions until the last minute because they really just dread it. And to me, that's a red flag. You should really be looking forward to these meetings and really be looking to them as a trustworthy guide for you. And then on that note, they should be someone that you can trust with your concerns. They should also encourage and respect your autonomy. Red flags include high rates of cesarean and or transfer, high rates of non-evidence-based practices like routine episiotomy, amniotomy, and induction, mentioning the possibility of cesarean or induction early in pregnancy. They can't determine labor progress without vaginal exams and or electronic fetal monitoring. That's a red flag. Doesn't allow or won't let you do XYZ. Uses belittling, mocking, dismissive, or patronizing language and behavior. Doesn't have time for you. So if they don't have time for you in pregnancy, they're not going to have that much time for you in labor either. Doesn't fully answer your questions. Not interested in learning more about you than what's written in your chart, because you are a person and you are not just a piece of paper with a bunch of numbers and dates on it. Another red flag is they have a habit of making decisions for you and or doesn't include you in plans related to your birth. So finally, please know you can change care providers at any time, literally any time. You can even fire your care provider in labor if you feel like it's in your best interest. Obviously, this is not ideal, but they're working for you, and if at some point you don't like how this relationship is going, you can simply discontinue care. During my own first pregnancy, I saw 4 different care providers, 3 OBs, and a midwife. I wasn't 100% happy with the OB that I ended up with, and I do kind of regret settling at that point, but I do understand how it can be really challenging emotionally to change at the last minute. So put in the work on the front end to get clear on what you want from your care provider and ask those hard questions from the very beginning. Switching really doesn't have to be complicated, and until your baby is out, you do still have options if willing to think outside the box a little bit. Hopefully you're able to put in that work on the front end to feel really great throughout pregnancy, and that your provider is a really awesome fit throughout that whole time. So I hope this was helpful, and good luck on your search with finding the perfect care provider for you. Thanks. Bye.